Hello and welcome back to the CT Educator podcast. Welcome, everybody. Thank you for joining me on another episode. So, today I want to go ahead and dive into this topic. We are going to talk about how COVID-19 has changed the dynamics in radiology departments and CT departments. So, of course, we are post-pandemic. Even though COVID is still very much there, still much real, whether people choose to accept it or not, it is still there. I know at the trauma hospital I work at currently, we only have, I think it's like, I want to say like 8 COVID patients. So the numbers have drastically dropped, but it's still a real thing. It's still out there. So it hasn't completely gone away. Now, I know when we started this pandemic, we had no idea how this would affect not only the entire world, but the world in healthcare, especially radiology. And as we went through that pandemic, which I know I worked through the entire pandemic, just like most of you have, and I am still working post-pandemic, that it has really changed not only how people view healthcare and view radiology departments and how much it's changed the whole dynamics on how we operate now. Because I know before, yes, we were short staffed. Yeah, they order a lot of fucking bullshit CTs, which they still do now. And I think it's just increased like tenfold. So that is just one piece that has just elevated and just has skyrocketed ever since this pandemic has just been full force. Now, I know personally for me, what we did experience is when COVID first hit, it was just running rampant everywhere. The entire state of Illinois was shut down because I remember the governor just shut it down. I could tell you, and I know this is going to sound funny, that traffic, anybody that lives in the city of Chicago knows that traffic is a bitch. And it doesn't matter what time of the day it is, traffic is horrible. Okay. So upon that, it was easier to get to work. They were monitoring on, who is an essential worker, who is not, who was going to let you cross state lines, things like that, because they were really monitoring that during that time. And grocery stores, I can't, all those things that we remember, just unbelievable. But there was a pattern that started to appear. And I don't know if any of you guys listening saw this pattern where when COVID was just full blown and the hospital was full of COVID patients, radiology was very quiet. I don't know if you guys noticed that, but we did. Like the amount of exams that we used to do just diminished so quickly. And there would be a lot of times on a shift, because I work a 12-hour shift, that we would sit there and we wouldn't do scans or anything for hours. It's because people were afraid to come to the hospital and everybody in the hospital had already been scanned. So there was really not a lot that they knew about this virus. And there wasn't anything diagnostic wise that's really going to help any of these people. So that is one pattern that we noticed. It was very quiet, very just dead, which we all know we don't say the Q word. So that is one thing that we had noticed as technologists in every department. Then, as we were going through the pandemic, the staffing had changed. Staffing levels had changed. I know personally for us, we had a couple of people that went out on maternity leave because they were pregnant during the pandemic. So we kind of lost staffing due to that. And because of our hospital mandating the COVID-19 vaccine, we lost quite a few techs because of that, because they did not agree with that type of mandate. So they ended up leaving, and we ended up losing quite a bit of staff during that time. So I'm not sure if any of you guys listening, if you've experienced that. I would love to hear your thoughts on that. The other thing is that once, vaccination had started happening, we were still having a lot of COVID patients, but as time went on, we started noticing a dwindle of COVID patients and our exams just going through the roof because there was a lot of patients who experienced long COVID, after effects of COVID, and a lot of respiratory problems and pulmonary problems that COVID just seemed to aggravate a lot of their medical issues. I could tell you right now, our staffing just became very scarce. I'm being really fucking honest with you right now. Like, we have lost 3 people in the last month, and it is just put a damper into our staffing where I am working constantly. And I'm pretty sure a lot of you that are listening to this episode are probably in the same boat. The other thing I noticed is that now we have all these open positions. A lot of people took traveling jobs because during COVID, that started to be a trend. And a lot of people left their staff jobs to go travel because that was just the thing to do. And hey, if the hospital is not going to appreciate the work that I've done to, be essential and be helpful in this healthcare community, then I'm going to take it and be valuable somewhere else. Now, I personally couldn't do that because I have children, and that is just not a setup for me. But I saw quite a few techs in my department that did do that. And I have a couple friends that do traveling jobs to this day. The other thing that I also noticed is the amount of vacant positions because of these travelers and the sign-on bonuses that people are advertising. It's fucking ridiculous. Oh my gosh. So the staffing levels have changed where now there is a critical need and just an urgency for CT techs out there and other modalities as well, but especially CT techs, that hospitals and clinics in all hiring facilities are offering these astronomical sign-on bonuses that are just so hard to pass up. Like, techs have choices now on where they want to work, considering the incentive that most of these organizations are offering. So that is like the thing that's happening now. And I could tell you, we are coming on to the July effect, and the bullshit ordering is starting, guys. I'm sorry, but I do cuss on this podcast because I am me, and this is me and my personality. Okay. So cover your child's ears. I have seen more ordering of CT exams now. We're working more and just overworking with less people. And I know you guys listening are probably in agreement with me as far as this trend, but the sign-on bonuses, the vacant positions, I know currently we have I think it's 6 or 7 open positions, and we've only filled 3 of them. And we have 2 travelers on top of that, so that are in our facility. So I'm not sure if you noticed that. I would love to hear your thoughts on it. Please let me know. I hope this episode was really helpful for you. And I plan on bringing you more educational content because I feel that there is really a urgency and a need to really educate CT techs because there's a high demand out there. So please let me know your thoughts. Don't hesitate to DM me on Instagram. My handle is the CT Educator. Please send me an email. I encourage all questions, comments, feedback, whatever the case may be. You can email me at contact@thecteducator.com. I will link everything in the show notes so you have a place to go ahead and reach out to me. I also have some courses and some PDF guides, an ebook. If you're a new technologist, you can go ahead and grab those resources and, get your learn on. Okay. So happy scanning, and I will see you guys in the next episode.